Going to start a couple minutes earlier by welcoming everyone back. Hopefully, we're all refreshed and have gotten ourselves physically recharged to have some stimulating discussions this afternoon, as I think we had this morning. Our next session really is sort of begins a shift to questions of infrastructure and governance. And in this session, we want to try and identify guiding principles, considerations, characteristics for infrastructure and governance of responsible sharing of clinical trial data. And particularly trying to look at models that take into account sort of the global nature of clinical trials and the different settings in which clinical trial data will be shared. So we actually have two panels, and they're going to be sort of overlapping. We're going to try and give people in each panel a chance to comment on the other as well. This one is going to be moderated by Tim Coetzee, and do you want to introduce your panel? I want to thank you in advance for coming. We're looking forward to hearing from you, and most of all, just interacting with you. I should just say as a framing, although we have talked a lot about in this committee in our sessions about some of the other aspects of our charge, particularly models of data sharing, risks, benefits, challenges. This is the first time we've really talked about governance infrastructure in detail. So we're going to be asking you a lot of questions and trying to get your thoughts and comments. Tim, thanks.
Well, thank you, Bernie. And so as Bernie mentioned, our session now starts what I think will be an interesting conversation around governance and infrastructure. We have three panelists that will each give about 10-minute presentations. We have Dr. Bartha Knoppers from the Center for Genomics and Policy at McGill University. She'll be followed by Dr. Philip Bourne, who is the Associate Director for Data Science at the NIH. And lastly, Mr. Glenn Cohen from the Petrie-Flom Center for Health and Law Policy and Biotechnology and Bioethics. Each of the panelists will give, as I said, a brief remarks around 10 minutes apiece, and we are ruthless with our time, so at 10 minutes, as you saw in the morning, I'll interject, and then after that, we'll have an opportunity for some Q&A. So Dr. Knoppers.